We're going to talk about glucagon today. Each time we do the medical director minutes, we try to cover one medication. So glucagon is something that is an optional drug in our 9th edition protocols. I thought that it would be something that, since it is an optional drug, not many people use it, so it would be a good review. So it has two main uses in EMS, and one of the primary uses is in hypoglycemic patients. And it's not a first-line medication. It is a medication that you use when you can't get IV access or intravascular access, such as an IO or IV. So it is sort of down the line of when you use it. But it is a good drug. It takes 8 to 10 minutes to work, so it's not something like D50 that's going to work immediately, but it does work. And the way it works in increasing glucose is it breaks down glycogen that is stored in the liver and turns it into glucose that's released in the bloodstream that can be used obviously by the body. So that's a simplistic way of explaining it, but basically it's a good, as we talked about, it's a drug that can be used. It's a good drug, but it's just not a quick acting drug. So that's probably the number one thing that is used in EMS. The second use is for beta blocker and calcium channel blocker overdoses. And in the beta blocker overdose, you have to have a high index of suspicion for beta blocker overdose. Many times it's not someone that really just takes a bunch of beta blockers. It's an elderly person who their beta blocker has been increased, their beta blocker has been started after being stopped for a while, etc. So it's not necessarily somebody that just took a bunch of beta blockers, although sometimes you see that. But obviously beta blocker overdoses, hypotensive, bradycardic patient, but they can also be hypoglycemic. So the way this works in beta blocker overdoses is it activates an enzyme that is separate from the catecholamine release, so that basically when you activate this process, it activates adenyl cyclase, and basically that will increase your heart rate as it increases cardiac activity. So, and it's sort of a mechanism in which it is, again, as I said, it's outside the catecholamine release. Many times, if you remember from your training, heart rate increases, blood pressure increases because of a catecholamine release. This is not a catecholamine release phenomenon. So it works very well as a sort of going back and forth from a hypoglycemic use and beta blocker use. I'm going to compare those a little bit. The thing that you have to keep in mind with a beta blocker overdose is you may have to have higher dosing of the glucagon. If you remember from your protocols, glucagon in hypoglycemic patients for a child is pediatric patients is 0.5 milligrams IV, and obviously that's category B, but for an adult it's a milligram IV. But for these beta blocker overdoses, you're talking about 5 to 10 milligrams. And you watch this patient, and if you need to repeat that in 10 minutes, half-life's about 20 minutes on the glucagon. So you may have to repeat that in 10 minutes. And some people even advocate starting an infusion with basically the medicine, the same dose that you're using to increase their blood pressure, increase their heart rate. So if you get a patient that gets better with glucagon, that's a beta blocker overdose, and you give them 5 milligrams, and you have to repeat that in 10 minutes, 15 minutes or so. If you want to put them on an infusion, then you can at 5 milligrams an hour. So you just have to mix that up. And again, that's sort of way down the line, but certainly something that you can keep in mind. One thing I want to talk about glucagon as far as in hypoglycemic patients is it won't work in malnourished patients. And so many times we see hypoglycemic patients that are malnourished, alcoholics. That's one reason that we give thiamine for these patients before we give glucagon. So if they're malnourished really need to consider giving thiamine before we give them the glucagon. There's some side effects with glucagon. One of the biggest things is tachycardia. As I mentioned, it does exactly what it's supposed to do with beta blocker overdoses, and it increases the heart rate. Well, as a side effect, it can cause tachycardia. You may see that sometimes when you're giving it for a hyperglycemic patient. It can cause an allergic reaction, so just keep that in mind. And one of the biggest things is it causes nausea and vomiting. So keep that in mind. Just be prepared that with glucagon, you're probably going to get some nausea and vomiting. So just keep that in mind. The other thing that we use it sometimes in the emergency department for is for esophageal foreign bodies. If you got an esophageal foreign body and you're trying to keep them out of the endoscopy lab, you can give them glucagon, and hopefully it will relax the esophagus enough that you can pass that food bolus, that piece of steak, etc., and keep them out of the endoscopy lab. So just keep that in mind. So recapping a little bit, I think the glucagon is a great medication. Two biggest issues or two biggest uses that we see in EMS, hypoglycemic patients and beta blocker and calcium channel blocker overdoses. Two totally different mechanisms of how it works. As far as each one of these situations, high doses that you may have to keep in mind that are needed for beta blocker overdoses, sort of a lower dose for a hypoglycemic patient. It's far down on the treatment list, so it's not a first-line treatment. This is sort of a rescue, almost a rescue medication that if you can't get an intravascular access, IO, IV, etc., and you need that medicine to get the blood sugar up. So just keep that in mind.